Over 400 million people worldwide are living with type 2 diabetes mellitus, which often develops silently and leads to serious health complications. In this video, I'll break down what type 2 diabetes mellitus is, and who's at risk of developing this medical condition. Type 2 diabetes mellitus is defined by three key characteristics: hyperglycemia, insulin resistance, and relative impairment in insulin secretion. Hyperglycemia is a condition in which the blood glucose level is higher than normal range. Insulin resistance indicates a strong clinical association of type 2 diabetes mellitus with obesity and other insulin-resistant states. Impaired insulin secretion caused by a dysfunction of the pancreatic beta cells which result in an inadequate insulin secretion. Risk factors of type 2 diabetes mellitus. Number 1. Obesity and excess adipose. Excess adipose or fat accumulation centrally, especially around internal organs in the abdominal region, is called central adiposity, visceral fat, android fat, or male-type obesity. This condition is the most important risk factor for type 2 diabetes mellitus. As abdominal fat accumulates and body mass index rises, tissue-level insulin resistance increases. Insulin acts like a key that binds to receptors on cells, the lock, unlocking them to allow glucose to enter. However, when cells become resistant to insulin, they no longer respond effectively, causing blood glucose levels to rise. This is a mechanism how insulin resistance causes hyperglycemia. Another risk factor of type 2 diabetes is genetic susceptibility. Type 2 diabetes is caused by a complex interaction of environmental factors and expression of multiple genes in susceptible people. Numerous studies have demonstrated that genetic factors contribute to the development of type 2 diabetes. Key observations supporting a genetic influence on the development of type 2 diabetes include: parental genetic factors play a significant role in the risk of developing diabetes in children. When one parent has diabetes, estimated risk of their child developing the disease in late adulthood in approximately 20%. If both parents are affected with type 2 diabetes, then this risk rises to approximately 30%, which means children with diabetic parents have almost 6 times higher risk for developing type 2 diabetes than children with unaffected parents. Another key observation supporting a genetic susceptibility as a risk factor of type 2 diabetes is monozygotic twins. In monozygotic twins, if one twin develops type 2 diabetes, the probability that the other twin will also develop the disease is approximately 90%, highlighting a strong genetic predisposition. Number 3 risk factor of type 2 diabetes is ethnicity. Ethnicity plays a significant role in the risk of developing type 2 diabetes due to a combination of genetic, biological, cultural, and socioeconomic factors. Higher-risk ethnic groups include South Asians, for example, Indian, Pakistani, Bangladeshi, African and Afro-Caribbean, Hispanic, Latino, Native American, Pacific Islanders. Number 4 risk factor of type 2 diabetes is age and pubertal status. The onset or progression of puberty is a risk factor for pediatric type 2 diabetes. Puberty is a developmental stage characterized by increased growth hormone activity, which leads to a reduction in insulin sensitivity by approximately 30%. This phenomenon is referred to as physiological insulin resistance and therefore increasing risk of pediatric type 2 diabetes at this stage. Sex is another risk factor for developing type 2 diabetes. Females are 1.2 to 1.7 times more likely than males to progress from prediabetes and develop type 2 diabetes during adolescence. The increased risk of type 2 diabetes in females may be associated with a higher likelihood of insulin resistance, which can be attributed to several factors. 1. The presence of polycystic ovary syndrome in adolescent females. 2. Higher levels of adiposity relative to lean body mass in females compared to males during adolescence. 3. Lower levels of physical activity among females than males in late adolescence. The last risk factor of type 2 diabetes is prenatal exposures. One hypothesis suggests that prenatal exposure to maternal undernutrition or gestational diabetes causes metabolic and hormonal changes in the offspring that promote obesity and insulin resistance and increase the risk for type 2 diabetes risk in adulthood. This phenomenon has been termed metabolic programming. If you're interested in learning more about metabolic programming, let me know. I'd be happy to create a video on it.
Thanks for watching. If you found this helpful, hit the like button and please subscribe to get future video lessons.